Hi, my name is Stacey Walsh. I'm from Maryville University, and this is my head-to-toe assessment. This is my daughter, Kerrigan Walsh. She's agreed to be my patient for the head-to-toe assessment. I've already asked Kerrigan to empty her bladder. I've also asked her to put a gown on. We've also taken her vital signs and her height and weight. We've also done the Snellen test to test her distant vision, as well as the Rosenbaum test to test her near vision. Okay, we're going to start with looking at Kerrigan, and we're going to just start by inspecting Kerrigan. We can get a lot of information just by inspecting the patient when they come in. We're looking at how they're dressed, how they act, how they walk when they come in the door, and those kind of things. We're going to start at Kerrigan's head. We're going to look at her skull, looking for any misshapen deformities, anything of the sort. We're also looking at her face. We're looking at symmetry of her eyes, her nose, as well as her ears. And then we're going to palpate Kerrigan's head. We're going to palpate her head. We're going to feel for any deformities, protrusions, any tender areas. We're also looking for any areas of, for her hair distribution, any areas of baldness. We're also feeling her hair. Hers is nice and silken smooth. We'd be looking for any coarseness, thinness, unusual thinness, brittleness. We're going to move down and we're going to start with Kerrigan's eyebrows, nice and symmetrical with nice even distribution. And then we're going to look at her eyes. We're going to look and inspect her eyelashes. They're nice and thick and full and with a nice curve to them. We're going to look at her sclera, make sure it's nice and white. There's no yellowing, no discharge. We're going to pull down her eye. We're going to look at the lacrimal apparatus. We're going to look for any bumps, any discharge, any redness, yellowness. We're also going to palpate the lacrimal apparatus for any bumps, any areas such as that. The next thing we're going to do when we're looking at Kerrigan's eyes, we're going to look at light reflex. And what we're doing here is we're looking, having her look forward, look straight at me at my nose. And we're going to look for her reflex of her eyes. We're looking at both eyes. You're going to look straight forward at me, Kerrigan. Excellent. And then we're going to do her visual fields. You're going to look straight at me, Kerrigan, and you're going to follow my fingers with your eyes, just your eyes only. Excellent. And we're going to do the same thing over here. And that's testing her cranial nerves and her ocular motor nerve. And then we're going to ask her to do the cover-uncover test. We're going to ask her to take this card. We're going to cover one of her eyes. She's going to look forward at a fixed spot on the wall. We're looking at how her eye accommodates. We're going to switch to the other eye, Kerrigan, and that's going to tell us how her eye accommodates. We're going to put that down. This will also tell us any extraocular eye movement as well. Okay, so then we're going to move on and we're going to look at her nose. In her nose, we're going to have her tip her head up. We're just going to inspect. We're going to inspect for any drainage. We're going to look at her septum, make sure that there's that's all nice and midline. And then with a light, we're going to inspect the inside of her nose for any drainage, redness, polyps, turbinates, and there is none. We're also going to look at her septum, make sure that's nice and midline. We're going to do a smell test for patency. Patency test. Breathe and breathe. Excellent. Okay, and then what we're also looking for is when we're looking at her face, we're going to check her sinuses. Sinuses, this is her frontal sinuses, any pain or tenderness?
No.
Ethmoid sinuses, any pain or tenderness?
No.
And her maxillary sinus, any pain or tenderness?
No.
Okay. And when we're looking at her face, we're also going to test her cranial nerves. I'm going to ask her to squeeze her eyes shut. Excellent. You can open them. Wrinkle your forehead. Excellent. Puff out your cheeks. Stick out your tongue. And smile. And that shows all good symmetry in testing her cranial nerves there. We're going to move on to Kerrigan's ears. They are nice and symmetrical, nice and even along here. We're looking at the auricle, the pinna. We're also going to palpate them for any protrusions, bumps, or bruising, and there's no discharge. Okay. And then along with her ears, we're going to look at her hearing. The first thing we're going to do is we're going to do the Weber test. Tell me if you can hear that on both sides.
Yeah.
And that would test her lateralization of her hearing. And then we're going to do the Rhine test. We're going to place this on her mastoid bone. You're going to tell me when you no longer hear that.
Can't hear it.
Okay. And then we're going to check air conduction. Tell me when you can no longer hear that.
Can't hear it.
Okay. And that should be an even amount of time. And we're checking bone and air conduction. We're also going to do the whisper test. We're going to go behind. We're going to have Kerrigan cover one ear. We're going to say a word and she's going to repeat it. So repeat after me, Kerrigan.
Purple.
And then this one. Orange.
Orange.
Okay. Excellent. Now we're going to move on to Kerrigan's mouth. We're going to look at her lips, make sure that they're nice and pink and moist and not cracked, which they are. We're going to have her open her mouth wide. We're looking at her, and lift right up for me. We're going to look at her soft palate, her hard palate. We're going to look at her teeth. Make sure there's no dental caries, no open area.
If you have a tongue detector, please do such as the gravity test, you put it into the back of the tongue and make sure that she's happy with it. Now we're going to go down and we're going to look at her neck. In her neck, we're looking for any open areas, so it's nice and symmetrical. We're also going to check her lymph nodes. While we're at it, we're going to check her pre-auricle, her post-auricle. We're going to go down.
Okay. Now we're going to look at her trachea, make sure it's nice and midline. We're looking for any protrusions, deviations, anything like that. Then we're going to palpate her carotids, palpating one at a time as not to occlude her carotids. We're going to palpate this side, her left, and then we're going to palpate her right. And we're going to palpate her thyroid. And by doing her thyroid, we would go behind her. We would displace one side and ask her to swallow. And then we would do the same thing on the other side, asking her to swallow. Okay, excellent. Check her claviculars. We're going to ask Kerrigan to turn around so we can do her back. We're going to look, when we look at her back, we're looking at her cervical spine and down to her thoracic spine and her lumbar spine. Okay, we're going to have you turn back around, Kerrigan. We're going to check her head movement and her neck movement. We're going to go to the side, to the other side, forward and back, and then straight forward. And then you're going to push against my hand. Good. Excellent. And then you're going to do the shoulder shrug. Excellent. Now we're going to inspect her arms. We're going to inspect them bilaterally, no open areas, checking for temperature and warmth, edema. We're looking at her nails. We're looking at her capillary refill, which is all good. We're going to look at her brachial, feel for her brachial pulse and her radial pulse. And we'll check the other side, brachial, radial, and her capillary refill, which is excellent. While we're here, we're going to check for her brachial tendon reflex. Arm this way, relax it. And we're going to look for movement in that hand. The same thing over here, movement in that hand. Excellent. We're going to look at Kerrigan's anterior chest, looking at both her heart and her lung sounds. First, we're just going to inspect it. We're going to make sure that she has nice, even breathing, nice symmetrical breathing. We're going to then palpate for any heaves, palpations, pulsations, unusual. We're going to go underneath here, palpate her laterally as well. And then we're going to percuss for any hyperresonance, tympany. We'll do that laterally. And then with this on too. For any adventitious lung sounds that we might hear on percussion. We're also going to feel for her apical pulse, fifth intercostal, midclavicular. And then finally we're going to listen to her lung sounds, posterior, or anteriorly and then laterally, and then we'll listen to them posteriorly. We're going to start by listening to her heart sounds. We're going to start with the aortic, pulmonic, Erb's point, tricuspid, and mitral. We're listening for S1, S2, gallops, heaves, murmurs with her. And then we're going to listen to her lung sounds. We're going to have her take a nice deep breath and out. Another one and out. We want to do this in a nice symmetrical pattern. We're going to go over here, listen to her laterally, listening laterally. Excellent. We're going to ask Kerrigan to turn around again. We've already looked at her spine. Now we're going to percuss her lung sounds in the back. We're also going to look at her diaphragmic excursion as well as her chest expansion. Take a nice deep breath, Kerrigan. Checking her chest expansion, which is excellent. I'm going to have you sit up straight. Okay, and now we're going to just palpate for any tactile fremitus, anything that we can feel there. Now we're going to percuss. And then we're also going to percuss her postovertebral angles, and they're good. Now we're going to listen and auscultate. Nice deep breath. Nice deep breath. Excellent. We're going to have Kerrigan turn back around. One of the things I forgot to do on Kerrigan's, I forgot to check her temporomandibular joint. We're going to have you bite down and move. No clicks, rubs, anything there. Now, with Kerrigan, we're going to ask her to lay down. When we're looking at the neck, we want to look for any jugular vein distension. We would look at that at the neck while we're inspecting the neck. Another thing we can do is place the patient at 45 degrees looking at jugular vein distension. We could also measure for jugular vein pressures as well with a ruler. So now we're going to move on to Kerrigan's abdomen. We're going to inspect the abdomen. We're going to look for any ascites, distension, fluid waves, pulsations on the naked abdomen. The next thing with an abdomen is we want to auscultate. We're going to auscultate the 4 quadrants initially. When we're listening for the 4 quadrants, we're going to listen for a period of 2 minutes. If we don't hear anything within 2 minutes, we can say that there's absent vowel sounds. We're going to do this in a nice symmetrical pattern. We're going to start with the right upper, left upper, left lower, and right lower. And then with auscultation, we're going to auscultate with the bell side of our stethoscope, and we're looking for aortic. We're listening for her aorta. And then we're going to listen for her right renal artery, for stenosis. We're going to listen to her iliac arteries. And then we're going to listen to her femoral arteries. Just a note, we're listening to all of her, we're auscultating over top of clothing for Kerrigan's protection. And then finally, we're going to percuss and palpate. We're going to start with percussing for her liver and her spleen. We're going to go down, listening for dullness. We would mark this, and then we would go back down again, listening for resonance. 3 to 12 centimeters is the average for her liver. The same thing we would percuss down for her spleen. We should not be able to really percuss her spleen or palpate her spleen. Then we want to lightly palpate her abdomen, being careful of tenderness of the abdomen. Then we're going to do a deeper palpation of her liver. We're going to have her roll up on her side. We're going to do a deeper palpation of her spleen. And then back on her belly. Deeper palpation for masses. And then finally her kidneys. Okay. We're going to have Kerrigan sit back up. Oh, I'm sorry, Kerrigan, lay back down. We're also going to feel for aortic pulsations right here. Okay, now you may move back up. Deep breath, blow it out, and hold it. Percuss again. Diaphragmic excursion, we would mark here 3 to 5 centimeters would tell us if that was any COPD or any lung compliance issues. All right, Kerrigan, we're almost done. We're going to have you turn back around. We're going to be looking at her lower extremities. These are, what we're looking for is symmetry, temperature. We're also going to look for hair distribution that would show us circulatory issues. We're also going to check her reflexes as well as check her pulses. So we're looking she has nice non-edematous legs. We're going to check her popliteal pulses on both sides, which are excellent. Or dorsalis pulses, posterior tibial pulses, dorsalis, posterior tibial, excellent. And then we're going to check her tendon reflexes and her strength. We're going to start with her strength. She's going to push against my hands, excellent. Push against my hands, excellent. And then finally we're going to check her reflexes. These are her popliteal reflexes, and finally her Achilles tendon reflexes. We're going to have her relax and we should see some movement in her legs. This concludes our head to toe assessment. We thank you for watching.